Welcome everyone today. I am Dr. Jen Cincurak, and we have as our guest today Dr. Penny Kendall-Reed. We are both naturopathic doctors, and although usually on YouTube I am talking about therapy called EFT or tapping, today we're going to do something a little bit different, and we're going to give you a sneak peek or preview into how your genes influence your health, both your mental wellness and physically what's happening in your life. And I'm really, really excited about this because I've done some amazing work with Penny, and I'm so excited to bring it to the rest of you. So Penny, welcome, and thank you so much for doing the interview.
Thank you so much. I mean, as you know, genetics is such a huge part of my life and a passion within my life. And with so many good reasons, it literally saved my life, and I've been able to help so many other patients with it. So it's something that's exciting, and I'm always happy to chat about.
Okay, so I'm really excited now because you just gave me another question I want to ask, which is, I didn't know that it saved your life. So we'll back up a little bit. And can you tell everyone who's watching, all of the practitioners out there, how did you come across this? Because there are plenty of ways to do, seemingly great ways to do genetic analysis, right?
Mm-hmm. So first of all, just to sort of backtrack as to why I got into genetics, I over the time I would see patients, as I'm sure you do. Two people would come in with what looks like the same symptoms. You
Mm-hmm.
would put one person on a treatment protocol, and they do fantastically well. Then you would put the next person on the same protocol, even though the labs were the same, their symptoms were the same, and they don't respond at all. So I kept thinking, well, I have to look outside of my box a little bit more because they don't fit into this box of symptom and lab work. And I found over the years, my boxes kept getting bigger and bigger and bigger, and I started having to extend more parameters. And we see this within any form of medicine. A patient will walk in, one person is on one blood pressure medication and it's down low. Another's on five and they can't seem to control it. And now I really start to see the reason why. So I started to look outside of that box even further, and that led me into genetics. I read an article on it and I went, wow, this is actually making a lot of sense to me. And the further I delved into it, we were able to see, well, why one person can't eat a carbohydrate the same size as the next person, because one person actually makes more insulin to that same carbohydrate than person B does, or they make more inflammatory markers to that same carbohydrate than person B does. Or somebody who's put on a diuretic, their ACE gene is absolutely fine. They don't need an ACE inhibitor. They don't need a diuretic. They need something to open up the blood vessels, increase nitric oxide, and vasodilate. So that's the only blood pressure medication they need. And you really can start to pinpoint and stop that guessing game of, okay, well, I'll try you on that supplement and see if it works, because it worked for that person. And so it forms the foundation, the basis of our body. It is not everything. The beauty of genetics is that we have the ability to turn on and off the expression of genes. So when a patient comes to me and they have a gene that's not a great coding, the wonderful thing is with all of the tools, particularly with the naturopathic realm, we can tweak that gene and say, you know what, let's turn off the expression of that one, or let's turn on the expression of this one. And we have the ability, as naturopaths, we talk about stimulating the innate healing response.
Mm-hmm.
Well, that's our genetics. We don't all have the same innate healing response. So the only way to figure out what you have and what we need to stimulate is by looking at our genes.
You're connecting so many pieces of the puzzle there.
Mhm.
And anyone who's gone through any training, any integrative physicians out there watching, it doesn't matter what your practice type is, think about all the patients you've had come in. And I just from personal experience know how it's so frustrating. And not just that, well, 80% of my patients respond so well to this treatment. How is it that you're not? I'm so sorry. How can I help you more? You know how frustrating that is as a practitioner. But then sometimes you have a patient who's on a protocol who's doing beautifully, and then suddenly it doesn't work anymore.
Exactly. So, a great case there could be something like we have we put them on a detoxification program. And all of a sudden their body feels light and their inflammatory reactions start to decrease. And that's great. We could take a look at their detox genes and perhaps they needed that. But when they come off that detoxification process, or program, we look at, well, did you actually need to stay on that? Because are your phase 2 detoxification genes, your clearance of things out of the body, really, really slow? So we actually need to bypass the function of that gene and keep you on something daily. Or by removing that detoxification process, did it really come to light your inflammatory markers, your interleukin-6, your tumor necrosis factor? Did they start to rear their head because you were actually lowering those with some of the same detoxification
Mm.
tools? And again, this allows you to get really specific of what do you need on a daily basis? What do we need to rotate in? What do you need as your foundation of health? Again, as naturopaths, we often look at everybody needs a probiotic or everybody needs vitamin D, or
Yes.
no, not so. Essential fatty acids, they can actually be really inflammatory and harmful to some people and saviors for another people. Curcumin, wonderful anti-inflammatory herb, fantastic for myself who has overactive phase 1 genes, really not good. It's actually pro-inflammatory for somebody who has underactive phase 1 genes. Exactly.
I really actually enjoyed that particularly because, when a product becomes a bit of a trend and everyone wants to use it, and everyone is super into curcumin these days, right? No, and add some
Exactly.
black pepper and you're good to go, right? And so I feel like the idea of being able to use the genes is kind of like shedding way more light on what you're working on. So you don't constantly feel like you're working in the dark. Because I remember, especially in the early days of my practice, hearing an elder speak at some continuing education event. And he was talking about really feeling like I'm operating with a blindfold on and I'm helping some people and not others. And I just feel that frustration so much. So it sounds really like using the genetics really helps you to bring way more light to that situation.
It certainly does. It takes off that blindfold. It's almost like when we got the MRI and all of a
Yeah.
sudden we see, so many different tissues inside the body. This
Yeah.
is sort of like my MRI machine. It's my way of
Yes.
looking inside and saying, what are your potential pathways? What is your potential health? What are the potential risks that we want to mitigate? But also, what's your potential health? And, I love it when people come to me and say, I feel good, but I want to stay feeling good. And that's also a really important part because genes get turned on with age. Stress turns on genes. But we can abuse our bodies when we're younger and get away with a lot. But as we age, those genes start to turn on, and that's when we start
Mm.
to really see a lot happen. That doesn't mean they don't happen with children. By all means, I still see a lot of children for this, but I really feel without knowing our genetics, we can't truly get a good foundation of our own personal health.
I'm really glad you brought up the aging, because how many people have the attitude of, well, I'm just getting older.
Mhm.
But it's not about, well, everything's breaking down. In fact, it might just be that some things are just turning on.
You're exactly right.
And that's a huge
Or
relief.
it's a huge relief because everybody loves to blame it on aging, and
Mhm.
again we can not literally slow down the amount of aging that we have by reducing our stress genes, balancing them out by dropping the inflammatory load. And the other thing that I also hear is, well, I ate that 10 years ago and I was absolutely fine all the time when I ate this way. Like, once again, things change, and
Mm.
now we may have turned on that dietary gene from eating too many of those certain foods, or turned on, you know, uh, a cholesterol making gene by eating too much saturated fat or by eating too many carbohydrates. And that's the other thing, we love to sort of cookie cutter treatment protocols. And
Mhm.
I've written
Everyone should do
many books.
keto.
Yeah. Oh, exactly. There's
Uh-huh.
actually a very few small percentage of people that are catered towards keto long term. Everybody is going to lose weight when they first do keto because you cut out all the sugar and carbs. Everyone is going to lose weight. The question is, what happens 6 to 8 weeks into that? Do you start plateauing and then slowly gaining that weight? Do you start to increase your inflammation? Are you unknowingly passing that saturated fat that you're eating, crossing it across the blood-brain barrier and forming some plaques in the brain? All of these little things that you might not know right now, they're going to rear their head later on in life. And this is what we want to prevent. And again, the only way to know that is looking at what your health platform is, your health genes.
And so this is relieving as well, because think of losing weight or maintaining a healthy diet is, I don't know, it's the most high selling platform anyone could go on, right? Because it's such a difficult thing. And it's so easy to hear, all of these people on a blog or a website, thousands of people in this Reddit column said, I should eat keto, or I should no, it's paleo or whatever the latest trend. Remember when it was zone way back when?
I remember when it was high carb, low fat. That's how old I am. But there's a reason why there is good scientific data behind all of those diets, because there is a subgroup of people that diet works for, right from high carb, low fat, all the way up to keto. The problem is there isn't one diet for everybody. Like, I've written several books. I don't carry any of them anymore. I have one coming out on genetics, and I will carry that one in my office, but I don't carry any of the others because they were all a version of a cookie cutter formula. So you can't just bypass that.
Ooh, so interesting that you're being that truthful and raw about it, that you're saying, no, this stuff I wrote that was seemingly relevant back then, now it's not. So good for you. So you said something about how the genes really changed things for you, and I would love to hear that story. I mean, we know how you discovered it for your patients, but so what happened for you?
So for myself, I was always someone, I've always eaten very clean. I always grew up in a very clean environment and healthy foods. And I maintained that all the way through my life. And yet I always felt when I went into a polluted city or a big city, I would feel unwell. I would feel ill. If I did a detoxification program, our traditional packaged detoxification programs, I would feel unwell. And the first time I did a detox, I thought, wow, I must have a lot of toxins in me because I'm nauseous and I'm sweating and I'm having all these things. But then it just never went away. Every time I would do it, same thing would happen. I'm like, I can't possibly have that much in me. And I also had one liver enzyme that was always elevated, could not figure out why. And then anytime I had an anesthetic, a general one for getting 4 wisdom teeth out. I had broken my nose when I was very young. I had an anesthetic. I was vomiting up that anesthetic left, right, and center. So I'd always get this nauseous, toxic response to whenever there was toxin in my body. And I was away actually giving a lecture in Arizona when I was, my appendix burst in the middle of the lecture.
Awesome.
So, exactly. Now I do have a very high pain threshold, which is also in my genetics. So I felt it like during it. I did actually fly down the night before with a little bit of gastric pain. The morning I woke up, it went to the right lower quadrant. And my husband was with me, who's a surgeon, meaning medical. And we were both being, good about it. We got a thermometer. I had no fever. I had no nausea. I had no vomiting. I was eating properly, normal bowel movements. We did a rebound tenderness test. There was absolutely nothing. So I'm like, okay, you know what? I feel okay. I just feel this little slight pain. So I went and did the lecture. During the lecture, I felt a kind of twist, and then I felt better. So I sat down after the lecture with my husband, and we were there on holiday afterwards to go hiking. So I said, you know what, let's just drive to our hotel. And if I don't feel well in the morning, then we'll go to the hospital. Felt absolutely fine in the morning. Hiked for 3 days, 14 miles each day, up huge mountains, down like hardcore. On the 3rd day, I looked at my husband, and that one we went 6 miles down into a canyon. I said, something's just not right. I said, I think I should go get it checked out. And literally saying it like that. So we drove back home. I hiked up the 6 miles back out, and we drove back to the hotel to research what hospital we wanted to go to. And then we went, and I came in, and my white blood cell count was normal. I had no fever. I had no nausea, but it was in the US, so they MRI'd me right away. And my appendix had burst 3 days prior. It had eroded a hole through my ileocecal valve, through the bowel, and all the tissue right around that hole was completely healthy. So they operated right away. And then the next day the surgeon came to me, and he's like, are you a freak of nature? I don't get it. He's like, you should have died with what happened. And I said, well, I don't know if this means anything, but about 1.5 years ago, I did my genetics, and I figured out that my phase 1 detoxification was too strong. My phase 2 was too low, which means any toxin that comes into my body, I produce too much inflammation to, and then I couldn't get it out. And so I put myself on supplements to reverse those 2 pathways. And ever since then, that one liver enzyme that was elevated, completely normal. If I ever went into a polluted city, I felt absolutely normal. And I can even remember saying to the anesthetist pre-op, I said, you have to give me a lot of Stemetil, like anti-nausea, because I will be vomiting up this anesthetic. I woke up, and the ICU nurse was right beside me because it was a bigger surgery because of the hole. So I was in ICU. And I looked at her, I said, I must still be sleeping, right? Because I'm not nauseous. And she's like, no, you're awake. I'm like, no, I must be sleeping. And so the next day when I spoke with the surgeon, he had actually just started studying genetics too. And he said, you saved your life with that. He said, if you had gone into that burst appendix with your normal genetics, you would have been one of those people who dies right on the spot. And so it literally saved my life, saved the quality of my life on a day-to-day basis. I can now walk through a city without feeling nauseous.
And you live in a large city.
And I live in Toronto. Exactly. So it's been a huge, profound impact on me. You know, when you were talking about weight, I have so many patients who come to me with weight, and you know, they've struggled for so many years, and they literally say, this is what I'm eating. I'm not cheating. And they're getting bigger. And when you look at their genes, you can see this is where your adiponectin is so low. This is where your leptin resistance is coming up high. This is where your ghrelin is really high. And once you start balancing those factors, I've never seen somebody not lose that weight. And that's the only way. Every other diet, you're just guessing. A lot of the metabolism comes down to those hormones, not the diet. The diet is just pushing it a little bit one way or the other. They actually need to get on something to balance those hormones out. And it gives them that control back and that freedom. And it's such a beautiful gift.
So for everyone who's watching this, maybe who's not a practitioner, or if you are and you've ever struggled with weight, like, do you not just feel years of pressure falling off your shoulders hearing this?
Mm-hmm.
So exciting. There's a million things I could pull from that, but thank you for that story. That's crazy. I can't believe that. And just the idea that a year and a half in from changing these steps, you can help yourself out so much.
So
A
much.
liver enzyme that had been high for decades.
My entire life, and nobody could figure it out.
Mm-hmm.
If I had a poor diet or lifestyle, I would have got it. And now it's never been abnormal.
Oh, so good. So good. Okay, so I'm so excited you told us that. Now, I'm wondering if you want to talk a little bit about, I mean, you've already mentioned this a bunch, but can you tell us a little bit more of a couple of examples of cases that you see where pre-using genetics and then post-using genetics, you've seen some change with your patients?
Absolutely. So one of the great places is cholesterol. So everybody loves to jump on high cholesterol being a saturated fat issue. And again, through genetics, we can see, are you actually producing that LDL through saturated fat, or actually is it through a carbohydrate? Or is it through a receptor that's actually being blocked? And that's the receptor that cholesterol will bind into to get cleared out. So you can look at all of these different variables within the cardiovascular system and within the dietary system and really see it. So you don't have to put people on these really deprivant diets of cutting out all of this or cutting out all of that. We can focus exactly in on what is the problem there. Similarly, blood pressure, you know, as we spoke about, we see so many people there. Is your blood pressure coming from your sympathetic nerve system? Is it coming from a lack of nitric oxide vasodilating them out? Is it coming from an inflammatory response in the endothelium of the blood vessel? Or actually, do you create too much ACE and so you need an ACE inhibitor? And rather than just guessing and going on all these different, whether they're natural or pharmaceutical meds, we can zone right in on each of that. Sleep. Is it because your sympathetic nervous system?
Mm-hmm.
Is it because your circadian rhythms are off from your clock gene? Do you make too much of a protein called cryptochrome 1 that then blocks your clock gene? Like, there's so many different variables. And again, rather than just throwing somebody on a sedative, even if it's natural and not harmful for the rest of life, we can pinpoint the cause of the problem and actually start to reset the body. So it really, to me, genetics is the foundation of natural medicine, because again, those two credos that we always have is get at the root cause and stimulate the innate healing response.
Yes.
To figure out those two variables, you need genetics.
I love how you've tied that in. And because genetics can seem so technical, but you do really help me to see how it really is part of that. Take care of yourself, go to the root cause, work with nature.
Exactly. People get a little scared of genetics because it sounds so scary. But again, once you know the foundation of health, and you know, you talk about, say, cytochrome P450, the CYP1A2 gene, or CYP3A4, it's just cytochrome P450. We know cytochrome P450. We know what that does. So it's just about stopping that fear of what that 1A2 or 3A4 may mean. And let's go back to, what does the cytochrome P450 gene or enzyme do in the body? What does adiponectin do in the body? What does ghrelin do in the body? What does cortisol do in the body? The genes are just showing me where it's coming from. But we know, once we know all of our pathophysiology from school, it's really easy to marry those two together.
Okay. Again, there's so many other areas that I want to say. And what about patients with this? And what about patients with that? But we'll get to that later, everyone who's watching. Okay, so I want to ask you this because as a practitioner, we all discover something new or like find a new type of therapy or fields or something about health as it's being discovered as we practice.
Mhm.
And it really helps to put the pieces of the puzzle together for us. And then we really practice using that for a while. But you still have struggles, right? So just because you're doing the genes, I want to know about, have you had struggles with patients where, because I can see how it would be easy to come in and say, okay, do my genes, poof, now I'm never going to have a problem with my blood pressure or my hormones or my whatever again. So what are the challenges that come up with you? And then how are you able to address it using the blend of the genes with all of your other tools?
So not everybody wants to do their genes. I would think the first caveat that I hear is I'm scared to find out anything. And so the one thing that I always tell them is the only genes I'm going to test with you are genes that I can do something about, or we can do something about together. I never want to hand somebody, oh my God, you got this gene with this coding, sorry, I don't know what to do about that. And there are genes, some genes, particularly some of the scary disease genes, that you can't change that gene, but what you can do is change a gene that affects that gene. I'm always going to test this gene. Don't really care about this gene, because as long as this one is in the right position, this guy's going to stay okay. So that's my first thing with them. But sometimes people have had a really clean lifestyle, or a lifestyle that just naturally keeps their genes in the proper position, whether that's on or off. So you might not need to do the genetics there. They might not be expressing that at that moment, or it might be an entirely different variable that's coming in. It could be an acute affection that starts to, color the picture of what's in front of you. So genetics alone doesn't have the sole answer, but if you marry genetics with the patient sitting in front of you, that's the key thing. Never lose sight of that patient that is sitting in front of you, the symptoms that they're expressing, the feelings that they have. And if you dig deep enough, you can always figure out where they're coming from. And I think as practitioners, we often get a little too caught up in just the symptom and our sort of differential diagnosis of what went along with that symptom. And genetics will show us it can often come from an entirely different place.
Mm-hmm. Okay, so I know from you, from chatting before, that when I was asking you, so where can I learn about genetics? And like, what courses did you take that were great? And you had an interesting answer for me, because this was a couple years ago. And you were saying, oh, well, I've done a lot of research and I've listened to a bunch of those courses. And so I want to know a little bit more about your journey into what you're doing now with genetics and how you're helping other people out, like other practitioners learn genetics.
So I never could find a good source, one source in one place to teach me genetics. A lot of the courses were only in one area, and they still weren't dealing with the treatment of genes, or they were, and the main thing is that people were looking at not the interaction of genes, but the treatment of gene by gene. And that's not the responsible way to do genetics. So I've spent over 10 years researching genetics, and I would go gene by gene. I would look at one website and look at all of the characteristics of that gene, and then I would go to the next one and the next one and the next one, and made sure they all matched up. And if the symptoms didn't match up and the reliability of that didn't look good, I would throw that gene out. If they did match up, then I start going back to the research papers. Okay, well, what shows that symptom caters with that one and that one and that one? And it literally took me years to figure that out. And then it went into, okay, so now I trust the science behind the genetics. Can I do something about it? Is this herb, is this nutrient, is this amino acid, is this lifestyle variable going to have an effect on it? And that was both trial and error with myself and with patients, as well as research. And then again, going back to, if I knew that I needed to reduce interleukin-6, well, I know that glutathione and NAC or resveratrol are going to do that. So we also have our tools within our naturopathic realm too, which really helped. And then it was about the integration of the genes. And by that, I mean, so for instance, there's three main genes that I look at for carbohydrates and what the body does with it. Most companies look at just one gene, that one called TCF7L2, and that talks about how much insulin that you make for carbohydrates. But then there's also one called IRF5. It does also talk about how much insulin you make. So if you're variant for both of them or code abnormally, you make even more insulin for them. But IRF5 also stimulates P13K pathways and IGF-1 pathways, so cancerous pathways with the consumption of carbohydrates. That's a really big variable for me to know that. Then there's another gene called GIPR, which talks about stimulation in the GI tract with carbohydrates. So we all think about if we get inflamed in our GI tract, we think about, oh, it's gluten for sure. Not I. A lot of the time, it's actually the sugar that's in that carbohydrate. Gluten happens to be there. But so you have to look at how they code specifically for each of those, and then what that means for their entire carb content and the type of carbohydrate they can have. Because they may code really well and fine for one. So you would say, great, you can have a lot of carbohydrate. Then they might code really poorly for another one. So then you say, oh, no, you shouldn't have any carbohydrate. And then maybe they're heterozygote for the third one. So what do you do for that person? Do you eat a lot? Do you not? And that's where the whole integration comes in. And so I spent many years building a platform with a ton of different algorithms for the integration of all of those genes together, so that all the possible permutations and combinations that could exist will come out and show their true colors, and then the treatment protocols that go along with it.
Okay, everyone. So I just want to recap here. This woman spent 10 years 10 years, after work, after seeing patients, and she would, like, for kicks, read research and study this so that she could help her patients out better. And then, like you said, you would, like, start trying it out on yourself and seeing how it worked, and then start trying it out on the patients who you'd known for a long time. You knew their cases really well, and you knew that you could help them out this way with, and then expanding it until finally you have enough proof of concept. You've used it enough with tons of different people and patients. Now you can teach other people, this is how you do it. And you've been teaching, like, docs, pharmacists,
everybody,
you name it,
worldwide.
Yeah, traveling around teaching. So tell us now, you have a book that you just referenced, and then you're talking about a program that you have. Can you tell us, what is it? What's it about? How do we access it?
Absolutely. So I have a book coming out this month. It's called Fix Your Genes to Fit Your Genes. So 2 different types of genes there. So this is the first of a series of books that I'll be doing. This is all on genetics with metabolics and dietary. So fats, proteins, carbohydrates, dairy, adiponectin, leptin, ghrelin, all of those, and all the various genes and what people can do about that. I have a platform called GeneRx.ca, which is where docs can go and upload their patients' 23andMe data and get the exact same report that I create for my patients. It is an editable report, so that if the patient isn't expressing that gene because they've kept it off for a lifestyle, the doc can then go in and change that treatment protocol. So, you know what, we don't need to use this supplement because I know you're not expressing that gene, or I like to use this company's supplement instead of this company's supplement, so we can edit it there. And then coming up, going to be doing a 5-course series with yourself on a variety of different topics on genetics, everything from metabolism to exercise to estrogen metabolism, detoxification, all the different mental wellness, a really important one right now, and how our genetics shows us why 2 people may go off to war, one person comes back with post-traumatic stress syndrome, and the other person seems absolutely fine. You know, what's going to happen mentally for a lot of people emotionally after COVID? What are the potential expressors that are coming up there? Who's actually more susceptible to this from an immune point of view, from an inflammatory point of view? All of those things will be revealed in our 5-course series.
Oh boy. And we're shooting this, guys, before we've recorded it. And I can't even tell you how excited I am to be hearing all this information. It's so good. So good. Okay. So how are we going to get access to that? So Penny, your program is called GeneRx. Your book is coming out this month. So this is June of 2020. It's called Fix Your Genes to Fit Your Genes. Yes. And We'll also post in this video how you can get access to the 5-part course. And this is like a taste so that you guys can see, all of you practitioners can see, oh, so this is how the hormones fit together. And this is how I look at this gene. And it's not just about this one gene, it's about these 4 genes that influence this one hormone, that sort of thing. So it's all very integrated. Or like you said, with the mental health and PTSD, or I think we're going to touch a little bit on like autism, maybe ADHD, and about like the genes for the neurotransmitters and how you can tell what kid might be more likely to express or not express certain qualities or traits based on those, and how you can alter those, most excitingly and importantly.
And that's the whole key, is how we can alter all of these different variables, no matter what the health condition is.
Awesome. Penny, thank you so much for taking the time to do this today. I loved it, and I've had the chance to speak with you many times, so I hope everyone else there is really eating this up as well.
I hope so too, because it's such a crucial component to our health, and it really, it sets your health stage for the rest of your life.
Yes, absolutely. And I'm fully experiencing that. So thank you once again. And everyone look out for the GeneRx course coming up.
Super. Thank you.